get this. A nap a day, that's all you need to keep the doctor away. New research by Greek doctors, of all people, shows that those who took midday snoozes had lower blood pressure than those who stayed awake throughout the day. The difference is enough to have significant impacts on rates of, you guessed it, heart attacks. Joining us now, Dr. Marty Makary, physician and professor of public health at Johns Hopkins. At some level, of course, who doesn't love their afternoon siesta, but it seems as though there's actually some science behind it, right, Doc?
Yeah, absolutely. You know, working from 9 to 5 in a chair, it turns out it's not good for your body. It's not good for your physiology, your musculoskeletal system. Now we know it's not good for your circadian rhythms either. In this study, they looked at over 300 middle-aged people, and the majority who had naps during the days had lower blood pressures, and the blood pressure was 6 points lower, so that's a real benefit.
When you look at this, how long of a nap do you need to take? I mean, are we at the point where if you're caught napping in your office chair after lunch, you go, "Hey, boss, gee, I'm just doing this for my health here"?
Well, probably most people who are benefiting are napping right now after lunch, but they've done studies that show at 5 minutes you have really no benefit. At 10 minutes you start to see a benefit, and at 20 minutes you see a benefit equivalent to 35 minutes towards sleep debt, which a lot of people have. It's sort of like the national debt. Sometimes you can never pay it off, but it helps a tiny bit.
All right, so is there, if you can get a little bit of a nap in the afternoon, is there something, and we hope that everyone waits 8 minutes before they take their nap when this show ends, but in that sense, do you have to eat something in particular before napping? Is there some kind of idea, okay, eat a really light lunch, or maybe just have an apple and go for a run? How does this all play together? Because obviously the Greek diet and the Spanish diet is very different than the American one.
Well, the authors of the studies suggested that the nap should not have you get into deep REM sleep, and that's why 20 minutes up to about an hour is where you can avoid the counterproductive naps. Over an hour, the naps hurt your rest during the day, make you more sleepy, and sugary foods are well known to make you tired, so if you avoid those, you'll have less daytime fatigue.
I'm not sure I've ever had a counterproductive nap, but we'll leave that there. Now, and move on to this. This is something very interesting. A lot of older folks have new knees, new hips, those kinds of things, and obviously it can give you a whole new lease on life in terms of being able to suddenly walk on the golf course, those kinds of things. But it seems as though there's some risks to knee and hip replacements that we may not have known about before.
Yeah, you know, it turns out that some people are frail, and when we talk about the surgical risks, we tend to talk about the 30-day risks. This new study from Boston University suggested that events happen even years later, and blood clots are higher among those who had surgery than those who didn't, even 3 to 5 years after the operation. So it turns out when we tell people, here's what you should watch out for after surgery, a lot of times they want to know about their functional and long-term health, and we haven't really studied that much.
At the same level, though, Doc, if you take somebody who needs a new knee, who can barely walk across the street, and suddenly you give them a new knee, and now they can go for long walks on the golf course and those kinds of things, does that not far outweigh this other risk, or have we not gotten that far yet?
We haven't gotten that far, but it is true. If you get a new knee or a new hip, as people did in the study, you tend to be more active, and that prevents clots. But there's some long-term effect on your blood vessels and the blood clotting system that years later, those that have the surgery still had markedly higher rates of the clots.
Interesting. So then folks have to think about and talk about. Dr. Marty Makary, thanks for your insights, sir. Appreciate it. And you can now go take a quick snooze.